Good day, Mr. and Mrs. America, from border to border, coast to coast, and to all the ships at sea. This is your correspondent, Jim Tate, and welcome to the Tate Chronicles. Join me as I cut through the fog that exists at the leading edge of healthcare technology. Come with me and explore emerging technologies that hold the potential to bring beneficial disruption to healthcare. I'm glad to say my guest today is Chrissa McFarlane, who's the founder and CEO of Patientory. Chrissa, welcome to the Tate Chronicles.
Thank you for having me, Tate.
Yep, really interested to talk to you about your company. You're the founder and CEO of Patientory. That's like Patientory, Patientory.com. And Chris, if you could tell me just a little bit about your background and why you created Patientory.
Yeah, well, Jen, I've been in healthcare for, as long as I can remember. My passion was to become a surgeon, and I went to an Ivy League college, pre-med, studied medicine, but I was always fascinated with this idea of entrepreneurship and business and, technology. So I decided to go to business school, found my way into healthcare IT consultant, and then worked for a couple of digital healthcare startups. The last one being telemedicine focused. So back when telemedicine was, a real buzzword around healthcare.
Absolutely, 2 or 3 years ago. Yep.
Yeah. My biggest issue was getting access to patient information, which led me to this concept of Patientory. How can we create a system, a healthcare ecosystem, where patients, regardless of what clinic or hospital they visit, they can walk away knowing that they have access to their info anywhere they go. And that doesn't have to be limited to the U.S., but it can be, to any country. So that's the goal of Patientory, Inc. We're empowering patients to take control of their health information.
Well, thank you for that, Chrissa. Almost every doctor or hospital we go to now, if they have certified technology, they're mandated to have some type of patient portal. But those patient portals are essentially data silos. You'd have to go to all those different portals. So it kind of sounds like Patientory aggregates your records from different providers and institutions. Is that the purpose?
Yes, correct. So we see ourselves as the bridge to these current siloed infrastructure systems.
And so you're the bridge, but how does your application actually plug in maybe to my general practitioner's EMR? How does the data come out of that EMR over to where I could view it in my Patientory account?
So we actually use a technology called blockchain, which is the blockchain is owned by the Patientory System Foundation. And this blockchain enables us, to decentralize this data, this information, across what we call nodes. So at this time and moment, our front end, that patients are able to access their information, integrates into a blockchain network ecosystem of essentially healthcare systems that would run this network to secure their health data.
Exactly. And let me ask you there, because blockchain is certainly a technology that fascinates me. I see it has the potential to be just incredibly disruptive to many domains, including healthcare. Seem to be a lot of fantastic uses for it and a lot of unnecessary uses for it. And in the case of other models for patient aggregated data, so you have your own account, you log in, and there's your data from a hospital visit or from a dermatologist or from your primary care physician. In what way did you find that blockchain was perhaps brought more functionality what you're trying to do than a non-blockchain application, just like a regular database or something like that?
Yeah, well, we've seen it already tried and, trued with regular databases. We've seen, companies like Microsoft, like Google, try to aggregate this information and was not successful in doing that. So we see the need for true incentivization in the industry and technology that's able to do that, so that we can actually, have this end goal of health information at the fingertips of the patient.
And so if I went and saw my doctor and they did in their EMR a visit documentation, what would come out of that EMR? Would it be some type of interoperability file like a CCDA that would then be stored in the Patientory blockchain? Is that, I'm just kind of interested in the plumbing or the wiring.
We have proprietary APIs that basically plugs into the data schema of these into EMRs, especially the electronic EMRs, that enables us to push and pull that information to our blockchain.
And that was one thing I know for the Office of the National Coordinator for the 2015 certification, any certified EHR, that was a requirement to have those APIs available to allow the exchange of data. So that's good.
Exactly.
Yeah. And so did you start working on your concept of Patientory, and then as you were visioning it and building it out, then you saw the advantages of blockchain and decided to use blockchain technology, or was that there from the beginning? I'm just curious about that.
Yeah, so it was, it's like the chicken and the egg question. I have always been following blockchain. The idea was always there, and it was figuring out how best to use, we had multiple technologies that we were trying to figure out, what would be best at the time, blockchain one of them, until we finally, decided to go with that.
And so I believe, and correct me if I'm wrong, that your blockchain is built on the Ethereum platform. Is that correct?
Yes.
And so that a lot of people call Ethereum blockchain 2.0 because it involves the use of those smart contracts that can facilitate payment for services to providers and things like that. Have you, I know it's probably on your roadmap, but at present, have you all taken advantage of that smart contract capability of Ethereum to expand what you're doing now?
Yes, we have. So much of our business is built using smart contracts.
And as you were working with blockchain technology and Ethereum, I'm always curious, a new technology like this, was it difficult to find developers who were conversant with this technology, or did you educate from within?
Absolutely. It still is. Yeah, they still are. They're in high demand.
Absolutely. Yeah. Well, and there's I've heard that from quite a few companies. It kind of reminds me a little bit, not a total analogy, but the early days of websites where there weren't a lot of people who could build a website, and they were hard and difficult to find a website developer. As time went on and better tools were developed to build websites, that became less an issue. But I know that with Ethereum and really anything to do with a smart contract, the underlying technology may be very solid, but if those smart contracts are not well written, there could be a problem there. So I know expertise in smart contracts is really a critical thing.
Absolutely. Especially with dealing with private, health data.
Sure. And speaking of health data, my understanding and from my research and talking to people is blockchain is not a good database. It may be the greatest way to keep a ledger or a list that cannot be changed. But you don't want to store probably a CT scan on the blockchain because it takes up too much room. So it's often those kind of images and large documents or large data files are stored off the main blockchain into a separate blockchain or a database. How do you handle things like images? Where are they stored?
Yeah, so our info is not stored on blockchains. It's, because like you said, it's not a good store of information. But as I mentioned, images are available to be previewed, via that UI that we have plugged in to interact with our blockchain.
Sure. Well, and so the images are stored off the blockchain, and maybe on the chain itself there's a hash encrypted pointer to an address where an image might exist off the blockchain, something like that, or
something like that.
Okay, sure. Now, just reading through your website and talking to some of your folks who were at the HIMSS conference in Las Vegas a couple of weeks ago, not only do you have a patient-facing application, but also your technology is intended to be leveraged by healthcare institutions or entities. And so how would a hospital use your technology, in a case where it's not just purely patient-facing?
It's not purely patient-facing. So the hospitals have a dashboard where they're able to, manage their patients on the Patientory system.
I see. And so it gives the hospital to decide what data they want to push to a particular account, or what happens on the hospital side? They're not looking at their own data. What happens on the hospital side? What are they seeing? What's the benefit of Patientory to the hospital?
They see all of the patient data from the patient, from their electronic medical records.
Okay, I see. Other than kind of some of the things that we discussed about the difficulty in finding people who are very conversant with blockchain technology, so far have you found any special challenges to blockchain technology, other than the fact it's hard to find people who really can develop in it?
The adoption, similar to the internet, it's a lot of education going on now in the industry.
To me, that's one of the biggest things, Chrissa, is when people hear some people have heard of blockchain. Very few could write a paragraph about what it is, but everybody's heard of Bitcoin. So they confuse Bitcoin with blockchain. And so the people that I've talked to over the last few months, and I mentioned blockchain and some of the great uses for blockchain technology, they'll say, well, how does it work? And you start to explain it a little bit, and they get very confused, and because they're confused, they don't see the value in it. Nobody really hardly knows how the internet works or how email works, but they use it every day. And so I think at some point, people aren't even going to care about the blockchain technology. They're just going to be involved with the benefits of it. But you're right, there is that public perception of is this safe? What happens when we get quantum computers? What happens when this or what happens with that? We are at a very funny kind of early stage of the whole rollout of blockchain technology. And, who needs to understand it? Who just needs to accept it and receive the benefits from it? So do you, Patientory, do you have for users, consumers, patients, is it in beta right now, or can they create an account?
It is now? In private. Yes, it is in private beta now. And we will be launching right before our inaugural Blockchain and Healthcare Summit that would be hosted in Atlanta on May 31st.
I've had heard about that. Some friends of mine who are very involved in blockchain in Atlanta sent me notification of that, and they're very excited about that. In particular, some of the speakers that you have coming in. So it's
very great group of individuals and all, blockchain enthusiasts, blockchain pioneers, in the healthcare space that's helping to drive this forward.
Yeah, it's really exciting. And so sometime before that, you think that there's going to be the availability for regular citizens to at least create a free account and drive the application around the block and use it some?
Absolutely. It's a very exciting time.
Yeah, I'm looking forward to trying that myself. So will there always be and maybe you haven't figured this hidden part of your business plan, but is there going to be a free version and then with extended benefits and features, a charge to store data, that kind of thing?
Absolutely.
I believe that that additional storage that somebody could, I don't know whether we want to call it renting or buying or whatever to keep the records in, their payments for that will be in a token that has been created. Is that correct?
Correct.
And the symbol for that token, is it PTOY or what's your symbol?
That's correct. That's the symbol.
Okay. Yeah. And so if I create an account and want to store a lot of CT scans and a lot of heavy data, and it's going to cost me X amount of these tokens that I pay for, rather than how would I obtain those tokens?
You can obtain those tokens through an exchange system on the exchanges currently that have the tokens listed. Or, really in our app, the tokens are there as well.
Sure. And that's kind of a new concept for a lot of consumers. But consumers are used to paying electronically. They go to Amazon. They're not really paying with money. With not paying with currency. They're really paying with electronic currency. So it's just another step away. And so will the only way to pay for storage be through the tokens, or will you accept other tokens like Bitcoins or Ether or anything else, or is it just your own proprietary token?
At this stage, we're only accepting our tokens.
Okay, sure. Kind of back to the smart contracts a little bit. I want to ask you a few more questions about that. And for the benefit of our audience, let's just talk about smart contracts for a minute, because to me, smart contracts brings significant power to a blockchain. And so a smart contract, as it states, to my understanding, is more or less a contract that says when a certain event occurs, something else can occur. And so this could mean if the model right now is if I go see a doctor, that doctor, and I have insurance, that doctor sends some documentation to my insurance company, and the insurance company reviews it and then pays the doctor. So there's a middleman there, the insurance company. With a smart contract, I could just have a contract backed by an insurance company or somebody else, but just says if a doctor sees me and performs a procedure or does some other type of treatment, as soon as that is documented, that smart contract on the blockchain will release payment. So it kind of removes the the middleman in all this, and a lot of friction out of the system. Is that the type of smart contracts y'all talking about for reimbursement for services, or are there some other potential smart contract usability y'all are thinking about?
No, that's you hit the nail right on the head.
Yeah, I think it's a big use for it in there. Actually, kind of a general question. I know you're probably spread out all over the place, but you're based in Atlanta, Georgia. Why Atlanta, Georgia?
That's where family is. And they definitely have a great growing, healthcare ecosystem. Sure.
And I imagine you were part in the early days of an incubator or some type of startup process. What was that?
Oh, you mean the accelerator?
Was that what? Did you go through an accelerator? Okay.
Yes, we did go through an accelerator in Boulder, actually. We went through Boomtown Health Tech. So we were their inaugural health tech portfolio class in 2016.
Yeah. I'm sorry, 2016?
Yeah.
Yeah. I looked at your the team that you're working with, that you've got behind you, Chrissa. It looks like folks with a lot of experience. How did you meet those people? How did you convince them to come work with you on Patientory? Kind of tell me a little bit about that.
Yeah, really through network. As I continue to develop and grow the company, through network, for employees, through job applications that we posted on the website. It's really just being able to have like a really strong network that you can tap into.
Sure. Yeah. Now, you mentioned this upcoming, I don't know if it's 1 or 2 day event that's going to be in Atlanta. Give me that date again, please.
That's May 31st.
Okay. How can people find out more about that or register for that? Is that available at your website, patientory.com? Or?
Yeah, it's actually available to register at www.ptoy.org. That's the Foundation Summit, so www.ptoy.org.
Okay. And is that going to be at your offices in Atlanta or another venue? Where's that going to be?
That will be at the Four Seasons in Atlanta.
Sure. Now, going all the way back to my first question about your background, you said you had started off and I believe went to, you were thinking about, I guess, being a physician, correct?
Yes.
Okay. And where'd you go to school?
I went to Cornell. Then
your involvement with telemedicine, and as we were discussing 2, 3, 4, 5 years ago, and still some people today think telemedicine is the next big thing. It had a whole year or two there when it was the next big thing. It certainly has some relevant applications, but it's not going to disrupt healthcare. I don't know if you agree with me or don't agree with me on that. I'd love to hear your opinions just on telemedicine.
I think it's definitely needed. I think it's one of the results of a true healthcare ecosystem, especially when you think of what it means to have, telemedicine and the parties involved and just that transfer of information in a private, secure method.
Yeah, it seems like rural health is a great application, access to specialists, things like that. Everybody really kind of thought it was going to take off much stronger. I guess there's limited coverage by insurance companies. And so much in healthcare is what gets reimbursed is what grows. There are quite a few naysayers against blockchain. Many of them say, it's really a fraudulent technology. Nothing will ever happen with it. We don't even really know who created it, et cetera, et cetera. You've heard all those kind of things. I don't know if people say that to you, but what is your answer to the people who say that blockchain is no big deal? It's just this year's telemedicine.
Well, I think, everyone has an opinion.
Yep.
Fortunately, there are good, projects in pilot, in proof of concepts that are being utilized now, and they're making a difference in blockchain, even outside of the realm of healthcare. When you look at, it really cracking down on fraud. We can go back and look at, supply chain management. So there is value that, is currently being added day by day in regards to blockchain.
A couple of things in healthcare that to me are just so obvious the benefits of blockchain. One is professional credentialing, being able to maintain and update the credentialing of healthcare providers. It often takes 4 to 6 weeks and a lot of money, and that 95% of that effort is removed with good blockchain technology. And clinical research, being able to get patient consents and store data that cannot be changed, brings a lot more, seems to me, validity to the whole issue around clinical research. I think we're within a year or two, once all these crypto coin, alternate coin confusion and static gets out of the way, it's hard to know whether it's going to be 2018, 2019, or 2020, but at some point there's going to be a tipping point where the blockchain doubters will, we won't be hearing too much about them because so much value is being brought to to a lot of domains. No doubt about that whatsoever.
Yeah.
We just have a couple more minutes. Is there anything else you'd want us to know, Chris, about Patientory or blockchain in general?
No, I think that's about it.
Okay, well, great. Well, I want to thank you for joining us today on this episode of the Tate Chronicles. And Chris, I want to offer a special salute to you, CEO and founder of Patientory. For those listeners, you can find more information on this show's program at healthcarenowradio.com. And until we meet again, here's wishing you smooth sailing and safe harbors.